Forehead lines are a really common concern for my patients. They say it makes them look older than they really are. Their makeup doesn't look as good when they've got the forehead lines. It makes them look tired. And it's a common concern that a lot of my patients have. The main reason why we get forehead lines is, well, it's twofold. You've firstly got a muscle on the forehead, which is called your frontalis muscle. And that muscle is responsible for raising your eyebrows. So when the muscle is active, you'll start seeing those fine lines which creep up onto the skin when the muscle is active. Second reason is just down to age, just down to lifetime, life changes. What happens is we start to lose collagen in the skin, we start to lose elasticity in the skin, and so those lines start to become more etched into the skin. When we're younger, the skin, if we raise our eyebrows, it springs back because we've got good elasticity, good collagen. But what happens over time is we start losing some of that collagen, so the lines don't spring back as they once did. And so we start to see those lines creeping up into the skin. So the forehead doesn't look as smooth as it once did. So in terms of treatments for the forehead, one of the most common treatments that we can provide is using Botox. So Botox is a muscle relaxant, and we deliver it with tiny needles just underneath the skin into the muscle. And what it helps to do is relax that muscle. So when you raise your eyebrows, as long as it's treated by an experienced professional, you'll still be able to raise your eyebrows, but you won't be able to see the creases or the wrinkles forming. That's a really good result. A poorer result is when you've got absolutely no movement with the forehead, and what can potentially happen when the forehead is treated, especially if it's over-treated or the wrong areas are treated, because this muscle is the only muscle which raises the eyebrow. If it's treated in isolation and it's over-treated, what can happen is it can drop the eyebrow. It can give you quite a heavy look. And that's not the aesthetic result that you want, because you want to look fresher, you want to have the skin look smoother, and you want to look less tired. You want to look awake and fresh and radiant. And if you've got hooded eyebrows and this looks really heavy, you're going to look more tired. So you want to make sure that you're going to a professional who knows all of this and who'll be able to explain that to you. And also treat you in the best way possible to get you the best possible result. So definitely Botox can be used for the forehead. It's not treated in isolation. So I get patients who come to see me who are perhaps not really concerned about the frown lines, or they're not concerned about any other lines on their face. It's mainly just the forehead lines that they're concerned about. This is the one area where it's not treated in isolation. It's treated in combination with another area. And the reason for this is because you do have the frontalis muscle, which is responsible for raising the eyebrows. However, when this muscle is relaxed, it means that there's no other muscle which is responsible for raising the eyebrow. So what we want to do is counteract that with relaxing a muscle which is responsible for bringing the eyebrows in and down. And so the muscles which are responsible for that is the muscles around the frown and also the muscles around the eye. So typically I'd be treating in between the eyebrows, and occasionally I'll be treating all three. So around the eyes, in between the eyebrows and the forehead. And of course you'd be going in for your face-to-face consultation, and we would determine the best form of treatment for you to get the result that you want. And so a lot of my patients do ask, and a lot of my patients actually come to see me where they've gone elsewhere and they've had their forehead treated in isolation, and the result they get is a drop brow or a heavy looking brow. And that's why they come and see me, and they say, well, last time I had a really poor result, so I'm not really that keen on having Botox done. What else can I do for my forehead? And so that's when education is really key. So it's sort of educating my patients, making sure that they understand why that result happened, and making sure that it doesn't happen again, and obviously giving them the treatment options that are available to them. So not to treat in isolation, make sure you go to a professional as well. And also, that's one of the possible risks that can occur. Another risk is, and I just had a patient yesterday actually that came to see me, and one of her friends who was getting Botox for the first time went to another clinic, and she'd been messaging my patient just saying, I've just had my Botox done, and I'm really, really excited to see the results. And then she had the results, which she may have seen sort of after 5 to 7 days. And unfortunately, she wasn't very happy with the result because one eyebrow was higher than the other. And that's a real shame, because when Botox works and you get a really great result, that you'll be so amazed at the results, and you'll just want to keep getting and maintaining that result because it looks so good. When it's done correctly, it looks great. However, when it's done incorrectly and you can tell that someone's had it done, then it's not so good. But if something like that were to occur, so if you were to get one eyebrow which is slightly higher than the other, then we can tweak it. So we can manipulate the Botox, we can manipulate the dose, we can manipulate the area that's being treated, and we can correct that. So if that is a concern, and you've gone elsewhere and you've had, your eyebrows don't sort of match up or level up, then it can always be tweaked. So that's just something to remember as well. Of course, as long as you're going to someone who knows how to do that, then that can be arranged for you. And I have had patients who, when they raise their eyebrows, one of the eyebrows is actually higher than the other naturally. And so they want to level it up and make it a bit more symmetrical. And so that's something that we can do by manipulating the dose and manipulating the area that's being treated. So that's the great thing about Botox. A lot of people, there's a lot of misconceptions about Botox and how, you'll see lots of YouTube videos and it looks pretty straightforward to inject. However, what you don't know is what goes behind the scenes, what dosage you're actually having, what kind of dilutions you're using, what specific areas are being injected. Because what your practitioner would be doing is mapping out the areas. They'll be assessing your forehead. They'll be assessing all of the muscles around it. We wouldn't be looking at your forehead in isolation. We'd be looking at your whole face. So although it looks quite straightforward, there's actually a lot that goes into your actual treatment planning and your actual treatment result. If Botox is not ideal for you, so I do have patients who have hooded eyelids already, so naturally they've got quite hooded eyelids. Forehead Botox is not ideal for them because it can potentially sort of make that worse, which again is not what you want. And so for those patients, I would recommend a different kind of treatment. So we can still use Botox in other areas, but for the forehead, it's not the intended or it's not the desired treatment that we want for them. So for them, we would be looking at a combination of medical grade skincare for them, and also possibly some microneedling to boost the collagen, and also to use some form of skin treatment, which is an injectable or a dermal filler, to help just improve and smooth out the skin. So that's forehead lines for you. So if you have any further questions regarding forehead lines, because this is actually a very, very common concern, and when it's done correctly, it looks great. When it's done incorrectly, it doesn't. And so make sure that, if you do have any questions, just pop them in the message below and I'll be more than happy to answer them for you. Thank you.